Good evening, Khalij Times viewers. This is Anjana Shankar. I am reporting live from inside a COVID ward in Dubai. I have already spent 8 hours in this coronavirus ward in Aster Hospital in Al Gisais. This is one of the hospitals which is treating patients, coronavirus patients. So before thank you everybody, thank you all KT viewers for following our live blog. Before I wrap up the coverage, the first thing that I would love to say is, please be safe, stay at home. I know that we all have been staying indoors, avoiding meeting friends, not going out anywhere, but after spending 8 hours inside the ward, talking to coronavirus patients, interacting with some of them, speaking to the doctors, what I would say is it's all worth it. It's all worth it, because I know we are frustrated. There are people talking about, why can't we relax some of these movement restrictions because we are dying to go out. But what I understood today is it is even more frustrating to stay inside a hospital like this. And especially if you see the efforts, the dedication with which our healthcare professionals are treating the coronavirus patients, the dedication that they are putting into their profession, the way they are risking infection, risking their lives to take care of patients. I think we have the responsibility to make sure that we stay at home so that they can take care of patients and the healthcare workers can also be safe. Just to give you a quick update on what I saw today in this, I'm going to flip the camera so that to give you a quick update on, I started my shift, if I can call it, at 10 a.m. and as you saw, I'm wearing a level 4 PPE protection suit. This is what all the healthcare workers here, medics, doctors who work inside a COVID ward, it is mandatory that you wear this suit that is for self-protection. We have been reading stories about how healthcare workers in different parts of the world have got infected because of their exposure. But here, luckily, doctors and medics were telling me that they're very privileged, they're very lucky to work here in Dubai, in the UAE, because so far there is enough PPE suits, there is no dearth of masks, protective masks and gear, so they are well protected while doing their job. So this is a reception area. Now you see it empty, but there are always nurses manning this reception area here. And this ward has a capacity of around 35 to 40 patients can be accommodated here. As you can see, these are the doctors, these are the nurses working here. This is on the second shift today. So they are all wearing the protective suit, whether they directly interact with the patients or not. And let me tell you, it's not easy what they are wearing. It is not easy. I got a first-hand experience of it, because the mask that you wear, it is your breathing gets difficult because it's very difficult to breathe through this mask, and the PPE suit that you wear, it's very hot inside. Despite the air conditioner, it's difficult. Your movement is restricted. And to talk about the facilities here, what I saw is, as I said, 35 to 40 patients are treated here in this COVID ward. There are 2 ICUs, intensive care units, where patients who need critical health care, critical treatment are admitted. And all of these rooms that you see around, most of the patients are on ventilators. They are breathing with the help of oxygen because of lung infections, pneumonia, various medical complications that are because of coronavirus. I'm not entering any of the rooms because it's important to protect the privacy of the patients. As a journalist, that is mandatory, that we don't breach the confidentiality agreement that we have signed, that we don't expose patients who especially don't want to be exposed. But during these 8 hours that I spent here, I interacted with patients. I also got access to the ICU, where it's a very painful sight, I must say, as a journalist, even as a person, to see people suffering, that too in isolation. Inside the ICU, I saw patients of different age category. There are mostly, I only saw men, because we have seen that it's mostly men who have got infected. So in this ward also, I only saw men, but they are of different age category. There were young men, as young as 22 or 28-year-olds. There are also patients who are, most of them, the majority of the patients are 40 plus. Some of them are already on the road to recovery. They have come out of ventilators, and the nurses, doctors say that that's one of the happiest moments for them here, when they see that a patient who was on ventilator, who was suffering, come out of the ventilator, starts breathing easily, and then there's a smile on their face. So I think maybe that is what makes this job rewarding for them. And there are also very emotional moments that you see when you're especially inside an ICU. Today I saw a patient who just came out of the ventilator, and the doctor who was treating him called his mother, gave the phone to him, and he could hear his mom speaking on the other side, and he was trying to say, he's from Kerala, he was trying to say Amma, Amma, which means mom, but he could hardly, his voice was hardly coming out because of the chest infections he had. But there were tears rolling down his through his cheeks, and a very emotional moment. And the doctors and nurses were smiling and telling him that now you should not cry, you should be happy because you came out of it, you fought this battle. So honestly, from what I understood is, this is definitely a battle. As journalists, we keep talking about, we keep reporting about the number of recoveries, the number of deaths in the UAE, the number of cases every day that we report in the paper. But more than just statistics, more than just these numbers, what I understood today is that these are human stories. These are real people. These are people like you and me and they are not just numbers, they are not just data. They have their families. And a lot of patients here, they suffer from depression and anxiety because they are isolated, they are not interacting with many people, and the only faces that they see is of doctors and nurses, and the faces like this covered with masks. So they crave for human interaction, and here the doctors and nurses who are attending to them, and to a large extent the nurses who are attending to them 24/7, it is not just a medical care that they give them. They are their friends, that they are the only people that they get to see for these 14 days when they are under treatment. So to help them fight this COVID, it's not just medicines, it's not just health care. So they also need a bit of tender loving care, they need some attention, they need a friend if they want to talk to. And that is what these nurses are doubling up as. That's what I saw in some of, when I accompanied some doctors and nurses to the ICU and to the wards, to the rooms. That is what I understood. These medics, when they are on duty, when they are risking infection and risking their lives to do their job, the last thing we should assume is that it is easy on them. It is definitely not easy, because they also go through psychological pressure, because this is this global pandemic that is ravaging across cities and countries, and there is an explosion of news about more deaths, number of cases rising, and as we are speaking, there are more than 2 million coronavirus positive cases and across the globe. So all of these create a lot of emotional pressure on them. But they, when I spoke to them, they said, we try to cut ourselves off from all these negative news, and we focus on what we have to do. And even nurses inside the ICU, they said, if you ask me whether we are scared, we won't lie to you. We are scared. There is a fear that we will contract infection, but there is a job to do, and if we say no, who else will do the job? So that is the spirit of these healthcare workers, the true heroes, the frontline warriors who are fighting this war against this pandemic. And Dubai, with its world-class healthcare facilities, is in the forefront. And as the doctors and medics say, that the country is pulling all stops to make sure that we contain the spread, we curb the spread, and it is a joint responsibility. So today, after 8 hours, what I understood is there has been no new cases that came in today. The doctors told me here, normally every day they get new cases, but today has been a good day so far. No new cases and no recoveries also. So for them, this is business as usual. This is what they do on a daily basis. And you see, most of them are either they live in their accommodations, they share it with their colleagues, or there are people who also have families who go back to their families. So there is a strict hygiene protocol that they have to follow here, where as soon as they step out of the COVID ward, they have to, take off. There is a process called donning and doffing. I was explained by the doctor in the morning when I wore the suit. So donning is when you put on the suit, and when by the time at the end of your duty, you doff. That is, you take off, and then you have to wash your hands thoroughly, and then you there's a special place where they can go and take showers, and they go take shower, change into a fresh pair of clothes. They don't take the clothes or shoes that they were wearing here, though it is covered, though it is protected. They don't take it home, they wrap it up, and then they have to wash it immediately. So especially for nurses or doctors who have kids and who have families back home, it's very difficult to do this day in and day out, where they can't touch anything at home, they can't interact with anybody before they go through these hygiene protocols to make sure that they are not infected, and also they don't pass on infections to others. One thing which I remember some of the nurses told me is that, see, there are a lot of stories about how medics are getting infected in UK, in Italy, in US. So that creates a lot of emotional pressure on them, and they say they feel very sad about it. That people like them, their colleagues who are helping patients, who are saving patients' lives, who are fighting this battle, that when they themselves fall sick, they said that is what is emotionally shattering them. But at the same time, they're very thankful to the UAE government, very thankful to the facilities that they have in Dubai, where there is no dearth of PPE gears. They are well protected, they are well taken care of, they have proper meals, they have place to rest, there is a lounge here. If they want to take a short break, they can. And also there is no mounting pressure. We know that even the best of best healthcare systems in the world are buckling under pressure because of the mounting number of cases. But in UAE, it is different. Though there are around 6,000 plus cases reported so far, but it is well under control. There are mass testings being done, and there are quarantine facilities set up all across the country, where patients, especially those tested positive but mild cases, or people who are asymptomatic, still to make sure that they don't spread infection, they are quarantined in different facilities like hotels, resorts. Buildings are converted into quarantine facilities. So when we see all of these efforts that the UAE government is doing, and the sacrifices of these healthcare workers, one thing is very clear, that we have a bigger responsibility. When they are doing their job, we have to do our job too, which is to stay home, avoid any chances of spreading infection, contracting infection and spreading it to others. That is a core responsibility that we have. I want to thank all the College Times viewers who have been following my live blog since morning. I would wrap up by saying that, I think this is a battle that we have to fight together, and this is a battle we have to win when healthcare workers are doing their bit and the UAE is pulling all stop, is not turning any stone unturned to make sure that we win over this killer virus. We don't let it spread further. I think we have a joint responsibility, which is basically to stay at home and stay safe. Thank you for watching. This is Anjana Shankar reporting live from inside a COVID ward in a Dubai hospital. Thank you.